call your friends and they hold your hands, baby, never mind, never mind. Never mind, never mind, never mind. If I left, then it ain't no sense.
Welcome to Hair Matters. Today we will be talking about cutting-edge procedures and injectables for hair, face, and body. I am with Noelle.
Hello.
Hi. And we're going to talk to Deb Fauci, a nurse injector from Ponce de Leon Med Spa in Reading, Mass. Hi.
Hi.
So I want to go over hair first. We'll talk about hair first since this is a Hair Matters podcast. At our salon, one of our specialties is working with men and women who have hair loss. Our approach is using human hair pieces, toppers, and hair extensions for those who suffer with trichotillomania, a hair pulling condition, alopecia, female pattern baldness, and male pattern baldness, and much more. What is so important is that our clients have the hair there to attach any of these techniques to. And you offer PRF, which is
Platelet-rich fibrin.
and A-cell has proven to give great results. Can you tell us how the process works?
So the whole process is about 45 minutes to an hour. It involves drawing blood, about 2 small vials of blood, and spinning it down in a centrifuge. And then at the very top is the fibrin matrix, and it's composed of growth factors, stem cells, in a matrix, and it's injected back into the head.
So fibrin's part of the body. Is that part of us?
Well, no. So it's the platelets, and it's in a fibrin matrix. Once it's spun down at a certain rate, certain tubes are used with no anticoagulation.
Okay.
Wow. So does something like this hurt?
Well, most say it's tolerable. There is a numbing cream that sits on the head for about 20 minutes before the injection.
Okay. So for something like this, how many treatments would be needed before you start seeing results?
Well, the whole process, it's recommended 3 treatments. It's 6 weeks apart. You definitely start seeing hair growth at the 6-week mark. So just before I inject the second treatment in your head,
Wow, you already start
definitely
seeing
see
results. That's incredible.
And that same process, to maintain those results, it's done annually.
That's incredible. So how is this treatment different from platelet-rich plasma?
So platelet-rich plasma is first generation concentrate. It has limited potential to stimulate regeneration because the growth factors are released really quickly. And it's also demonstrated that the anticoagulant that's required for the PRP preparation may have toxic effects on the body cells, which has resulted in search for a new treatment. Which platelet-rich fibrin, is first used in 2001. It's superior to PRP. It's more natural. There's no anticoagulant in there at all. It's biomaterial.
So is this what a lot of athletes are using when they have injuries? Are these the injections?
It is. So that's injected into the joints, and it helps with rejuvenating, cartilage and all that. And it's very popular in dentistry.
What scares me, Aurora, is when we talked before, Deb, is that you said there may be plastic in the PRP, which I've had that done.
Well, I was going to say that's something that they're doing to everyone's
our
face right now.
Yeah. So how do we know if we have plastic in our face?
Well, it is. Because PRP is a 2-step process, and there is an anticoagulant in the tube. So when they pull it up and draw it out, you do end up with preservatives, which they, like I said, are toxic to the cells and plastic pieces. Where PRF, there's nothing in the tube except for your blood.
But you can only use the PRF for hair, scalp. Or any type of...
No, not true. You can put it in the face to rejuvenate collagen as well.
Oh.
So all the places you would use PRP, you can use PRF.
Oh, very interesting.
And there's no microneedling? Or would you if you use on the face, would you microneedle it in?
Well, that would be what you've heard of vampire facial.
Correct, yes.
That would be microneedling PRP or PRF into the face.
Oh, so that's the biggest thing that's going on right now.
So there's a little confusion because it is different from the vampire face lift. That is actually injecting it into the face with needles.
Oh, okay. Wow.
The facial is the microneedling. The
I see.
facelift is injecting it into the face deeper.
And you inject into the scalp, and that can give us some great hair growth. Because as Aurora said, we can help on an aesthetic level, but even hair transplants have failed for some of our clients. So that being said, if this can produce more hair, and I've seen pictures that you've shown me, in especially men, because you would think a lot of men have
Yeah.
really dead follicles. You've rejuvenated some amazing heads of hair, so that's very impressive.
No, it is proven to give great results, and it works. It's natural.
So let's talk about places where we can use this. So brows are really in right now. Full brows are everything. So can you use this to create brow growth?
Oh, yeah, they're putting it in brows. You can put it in beards. You know, people do have scattered hair growth for the beards. You can put it anywhere that there's a hair follicle and you want to grow hair, basically.
And does this work with hair transplant, people who've had hair transplants?
Yes, it's actually beneficial and works very well with those type of clients.
When would you actually suggest, if they're doing a hair transplant, when would you say, okay, you can come in for the PRF treatment? How soon after? Or would you wait for the full length of the hair transplant time frame to occur and then do the injectable?
I would say a good 6 weeks waiting
Okay.
post that and then to start doing that.
Yeah, because as I said, women are just not getting the great results in length from hair transplants. So,
I feel like it's not that popular for women to even talk about having hair loss.
The problem with the transplant is you have to take hair from the back of your head, and it's not a one and done, as
Can
we
you
were talking
see
about.
from the back that there's hair missing?
You've seen it.
Yeah, I have actually.
Yeah, we see it a lot, especially, a lot of our transgender clients, they end up doing a lot of hair transplants.
And also, I've seen it. Well, I haven't seen it been done, but I know that it's a very painful procedure to do hair transplant. So
I
if
would
you could,
take PRF any
I
day
was
over
going to
that.
say if there's a different technique that you could do.
Well, not only that, the hair transplants, it's not a one and done.
Right.
Yeah.
You still need to do something to maintain that growth. And this is perfect for that.
Yeah, I think we really need to get those pictures out there. We'll get them on Instagram.
Yeah, I think people love to see it, and it's also great for women to have another option.
And what do you think about the people who have trick? That's like a big majority of our client base. And trichotillomania, as you explained, is hair pulling. They have potentially damaged follicles. So if they get to their follicles now with this, would it be helpful?
Or is it too much scar tissue, right?
Yeah.
Yeah. So if it's, you need to be able to visibly see the hair follicle, and you can easily take a look at someone's scalp. It doesn't matter, how sparse it is, thin, short, fuzzy. Your hair follicles are still alive and kicking and sprouting new hair, if you can see that. So if you can't see that,
And if you can't, come to us and we'll tell you, or Deb will tell you.
Awesome. So I'm going to switch this up a little. I'm going to get into what I really love to talk about.
Yes.
You offer so many other procedures.
And you have 2 clients here now. That's
Yeah,
it.
exactly.
For life.
So let's talk about some of the most common. And can you just give us a little difference and benefits of Botox, Nutox, Xyomin, which, am I saying this right?
Zeman.
Zeman. I don't.
Mental block.
Mental. It's like, well, because it's spelled with an X and it's a Z, but whatever. And Dysport. Can you just talk about the difference and what you like and go from there?
Yeah, so they're all anti-wrinkle injections. The main difference between all 4 is Zeman. Zeman is referred to as the naked injectable. It's the purest toxin on the market today.
I love that. Purest toxin.
I know, huh?
Yeah, it does not contain any additives.
Okay.
So that's the better of all of them because it's the purest?
Yeah, well,
That
no, I
botulism
wouldn't
in our
say
head.
it's the purest. So the benefit from having a pure form injectable is the human body is less likely to become resistant to it.
Okay. So, speaking of that, I want to talk about preventative measures. Now, I'm 31, and I know that I'm actually probably a little over the age of preventative measures. Well, that's really what's in style now.
I'm rolling my eyes, but
Yeah. So, so what age should someone start preventative? And if that's the case, if you're starting too early with these, like you just said, Botox can cause you can kind of get resistance from Botox. I mean, is that
Well, with chronic use, yes. It's rare, but it can happen, which means you need to switch to something else. And the only thing on the market without the proteins would be Zeman.
okay? So there are other options if you do become immune to Botox and it doesn't work for you anymore.
Yeah, you basically build up antibodies and it just wouldn't work. It's resistant to it.
So what age should I?
Well, prevention is key.
Yeah.
My advice to start treating lines when they begin to stick around. So when you smile or frown, those lines will be there, but then at rest they go away. So once they start sticking around, that's a good time. And anywhere between your late 20s and 30s, people are doing it.
Because that's when lines start sticking around. Pretty much. Okay. Awesome. So I know that you offer an aqua gold treatment. That sounds amazing because aqua and gold sound just the best.
Just beautiful colors.
Right? So
Yeah.
tell me, what is that treatment?
Well, it basically, that treatment will turn a prune into a plum. It really
Oh.
plumps and rejuvenates the skin.
I'm there.
A prune into a plum. I love that.
Yeah. So it's micro injections. It's a little device. It has about 24 karat gold hollow needles that you can deliver hyaluronic acids and anti-wrinkle into the entire face, even under eye, all the way up to the lash line in places that you wouldn't put a needle with Botox or any other anti-wrinkle.
How long has this been around?
It's fairly, I would say, the end of last year.
Oh, okay.
So not that long, maybe 5 months.
So I've seen a video of this being done, and the woman was actually doing it to herself, which makes me think that it's not painful. Is it painful?
It's not. No,
Okay.
it's not painful. In fact, the needles are as thin as a hair.
Oh, wow.
A
So
thin
it's not
hair
like
strand.
micro needling, nothing.
No, it's
No.
much thinner. It's pain-free, and you don't use numbing on the face
And
for
how
it. It's
long
not
does it last?
necessary.
Because at our salon, we just sit there and we'll talk about all sorts of different.
People always ask how long
Procedures.
do things last.
Well,
Yeah.
this certainly is not going to replace your Botox or filler, but because this is delivered into a different layer of the skin, into the dermis, where your anti-wrinkle injections are delivered into the muscle. So this treatment is something that you do above and beyond your basic fillers and Botox.
So kind of an in-between treatment?
well, you
or-
can do it at the same time. It's going to last you a good 3 to 4 months as well.
And can you start this at any age?
Any age.
You're all about the age. You don't have a wrinkle on your face.
Well,
She's
I
interested.
I'm
She's
interested.
interested,
I
yeah.
would like to keep it that way.
Well, that's exactly, yeah.
So
I'll let you know.
Prevention is key.
and I just, and also I'm sure it helps with any scarring, anything like that too, as well.
Yeah, it's really beautiful for anyone that has acne scars.
Yep.
It really plumps the skin and it helps with that.
Yeah. I mean, why not?
No, I agree with. I listen. I don't want a 15-year-old doing it.
Oh no, absolutely.
But
I, mean,
I
15.
think-
but I think it's if you don't want to rush to go right into the heavy hitters, which are like the Botox and the
Yeah.
injectables, this is like a good way to kind
Oh,
of
I think it's
ease
great.
your way
Sure.
in.
I think it's all great, and prevention is key. What did you describe it as? The
A
bank?
prune.
No. There was something you said.
Making your collagen.
Yeah, banking your collagen.
Yes.
I need some of that.
So, all right. So let's talk about a celebrity that we all know.
Oh,
Well, so Kylie Jenner is the poster child for injectables. What do you think she has had done? Besides everything.
Everything exactly.
Well, we all know she was public with her lip injections.
After everyone bought those awful
And
suction
blew up
cups
their
for
lips, like literally
Right.
blew up their lips.
I know.
She's had a nose job done.
I think her chin has been augmented in some
Her chin,
fashion.
her breasts, her hips, her butt.
Do you think she's done her body with any type of, well, we know probably lipo, but do you think she's done any type of like butt injections, or you think she's done some type of fat contouring or Sculptra, which is an option?
She's definitely done body contouring with fat injections and Sculptra.
So she's transferred her fat.
Oh, yeah.
Yeah.
And, you know, that episode way back about the Kardashians getting x-rays, trying to prove they didn't have implants.
Right. Well, I was going to bring that up too. I remember seeing that, and everyone was like, "Oh, leave them alone. They don't have anything. They didn't do anything." But they were probably just doing.
But
well,
that
the
transfers.
augmentation was with Sculptra.
Yeah, so
Right.
so you think what they have then, to break it down, is a fat transfer, and then they go back in with Sculptra every so often. That's how Kim's butt keeps growing, because she can't be going under the knife constantly.
But
Right.
answer me this. So I've also heard that when you do fat transfer, now this could be just a myth, what happens is that fat area kind of contains all your fat. Like it keeps on getting bigger and bigger and bigger. So if you're putting all your fat into your bum, let's say, your area of your bum will be the area that all your fat kind of collects to. Is that true?
I don't think so.
No.
No?
I heard that it actually goes away, the fat transfer,
Really?
over time. I mean,
Well,
Well,
it
we
breaks
don't know.
down.
it breaks down, right?
Right, just as any filler would.
Yeah.
And Sculptra is a volume enhancing injectable, and it's for longer term. So that can last anywhere from 2 to 5 years.
You think
Years.
You think it
Years.
lasts longer than a fat transfer?
Well, everyone's body breaks down at different rates. So
Well, butts are in, so. But it would take a lot of Sculptra to fill some butts. How much, I don't know how it all works out, but how much Sculptra is actually used?
well, it comes in a powdered form in a vial, and you need to reconstitute that. And when we're talking putting Sculptra in someone's face to regenerate their collagen, you would typically go with 1 vial per decade. So someone in their 50s would get 5 vials in their face. So you would break it down into several appointments. So maybe 2 vials at one appointment, 6 weeks later, anywhere between 4 to 6 weeks. So 5 weeks is the sweet spot. Do another 2 vials, and then the last appointment, give them their final 5th vial.
So what confuses me between Sculptra and other fillers is Sculptra you don't see immediately? Is that how it works?
Right. You will see something initially, and then it goes away. It basically deflates. And then it silently builds and banks your collagen.
So it's actually better than, as far as your face too, would you use Sculptra before another type of injectable?
Well, you know, a lot of people put hyaluronic acid fillers in their face, and your body breaks them down, metabolizes them. So a filler they may last, we'll say a year, they're coming back in 2 months that it's gone. They need another one. So people like that burn through fillers quickly, hyaluronic acid, Sculptra is recommended for those individuals because it won't do that, and it's longer lasting.
So speaking of fillers of the face and people keep on coming back, the cat lady look is it can really happen fast. I think for some people, they don't even realize, and then one day they have all this filler in their face. Are you pretty open with your clients, or your patients, I should say, and when you're like, okay, enough is enough, you don't need this, stop coming back for a little bit? I mean, are you?
Well, the look with the cat lady is more, she may be looking for that look. So
Why?
it depends on placement with your anti-wrinkle injections. And then she definitely is overfilled with fillers. And that's what you don't want to do.
The sad part is it's just like us with hair. People want more hair extensions, and sometimes we just say no.
Your head's
Because
not big enough.
overcorrecting something isn't the answer.
Exactly.
Right.
But you know that person's going to go someplace else.
Well, right. And
unfortunately.
that's typically what they will.
But I went somewhere this past weekend, and I saw someone I hadn't seen in years. She had shiny, beautiful skin, like the bottom of a baby's bottom, basically, just beautiful.
Ice skating rink.
Yeah, it was. But I was mortified because talk about cat lady. I don't know if it's just constant sculpture or rejuvenating, but the cheekbones were so high that she no longer had, visibly you couldn't see an under eye. I think that's the cat lady look.
Yeah.
I think it starts to get rid of the eye. Not that, I would love to have a smoother under eye.
Well, I
but-
wouldn't say sculptor is to blame. It's
No.
probably a lot of, fillers in general, and she's got a lot of inflammation going on. Her body can't handle it, and it's really cluttered in her face. So she probably needs a type of lymphatic drainage to help with
goodness gracious.
the inflammation.
But what do you think? But what makes the skin so shiny? Is that lasering all the time?
Because it's so full. Think about someone that has a heart condition and they have all the fluid in their legs. It's
Right.
shiny,
She
taut
needs
skin.
Lasix. Yeah.
Yeah.
Oh
LASIK.
my God, to pee it up.
Well, a steroid in that case to help with the inflammation.
Well, I'm sorry, but whoever's working on her has to stop. She has to stop.
No, it's true. I definitely, but it's like you said, with extensions or hair color. When people want to go blonde, it's like your hair cannot take it. I cannot make you
Well,
blonde.
there comes a point where we look bad. Because if I would absolutely go to this girl and say, "Oh, who does your face?" And if she told me who does her face, I would say, "I'm
They
staying
need to
away from that
report
person.
that person.
I'm staying away from them."
Well, at the same time, I think we can, generalize with anything. It's someone that, wants to lose weight and they get too thin.
Correct,
And they
yes.
want to keep going. It's just,
Yeah, but this seems to be, with the advent of, such popularity, with plastic surgery and fillers, it seems to be taking off that even celebrities today, they are looking insane. They've ruined themselves.
right. And end up looking like cartoon characters.
Yeah.
It's funny. And another thing that makes people crazy besides cat lady is lip fillers, which we were talking about before with Kylie Jenner. And I think that this overdone, you just look, the lip sometimes looks so like stretched. Do you know?
Well, the goal is to have no one know that you had something done. So you want to
Exactly.
look natural. But you would be surprised the amount of people that come in and say, I want that lip flip. I want the duck lip. I want them big.
Yeah.
So it's what they're looking
They have
for.
2 hot dogs on their lips. It looks like 2 stretched out
It
hot dogs.
really does,
doesn't it?
It just, yeah. And
I
I like a little bit of
I do.
everything.
I think it's a shame for anybody who's born naturally beautiful, because they're not just getting the credit anymore. Everybody can kind of replicate that.
That's true. But
Unfortunately.
I do think that, like we were saying, like you can replicate it to a certain extent. And that comes back to what we talked about with hair, where even when you add extensions, if you don't have I'm not saying nice hair, but if you don't have good hair to begin with, it's never going to look
It's always as good as the foundation.
right.
Truly.
Right.
Yes, I agree with that.
And same with the face.
Yeah, absolutely. And the eyes and everything else.
So how can we make these procedures last as long as possible so that, you're thinking about how expensive they could be and going every few times a year. How can we keep them to last as long as possible?
Well, it's all about product too. There's so many different products on the market today. And like I had said, hyaluronic acid is broken down quicker and people burn through that quicker. So you would go to a longer lasting, which would be Sculptra or Radius.
No, I'm sorry. Go ahead.
I had heard something from somebody. Is it true if you work out a lot, you'll burn through your fillers faster?
Yeah, because your body metabolizes it.
Okay. I wasn't sure. And Botox too?
Yes.
Okay. All right.
It's supposed to last 3 to 4 months, and some clients, it lasts 2 months.
So do you think the longer you wait in between before you do it again, the better? Because I've also heard that if you kind of do it not so often, the results last longer when you do it, or no?
No, that's not. When your metabolism slows down, when you get
That's
older,
when they last the longest.
that's when it lasts longer.
Well, that's a good part of getting older.
Or having a
Right.
slow metabolism. So, okay, awesome. So, are there any?
I was curious about the face tightening. What's out there on
The
the
liquid
market.
facelift?
Well, I don't know what a liquid facelift is.
Well, liquid facelift is basically using PRP or PRF with a dermal filler. So mixing them both and injecting it into the face.
So I thought that it was Botox and filler and injecting. Can you do that?
No.
No, you can't.
No. So the point of mixing the PRP or PRF with a dermal filler, so you're stimulating your own collagen growth, with that blood product, and then the dermal filler is giving you instant.
Wow.
So you get short and long-term results.
If you
with
had
that.
to pick one, and I know you're not going to want to, I know what you're going to say. You really need both. But if you had to pick a filler or some form of laser, what would you pick? If it was one or the other, when I say laser, like I know you work with L-therapy, correct?
L-therapy, yes. That's a skin tightening device.
Okay, so if you had to pick skin tightening or filler, what would you pick?
Well, they're two different things. So,
I know they are, but what would you pick if you could only do one?
Well, the foundation is L-therapy, which is a non-surgical facelift.
Okay.
I love that, a non-surgical facelift, because I think a lot of people are scared with cutting their face, cutting anything.
Well, there's a lot of downtime. You're at risk for infection. You're out of work a good 6 weeks.
Yeah. And then it only lasts, 10 years? And you have to do it again?
Not only that, you still need to maintain and do something each year to maintain those results. I mean, you make an investment, you need to protect it, right?
Yep.
So you need to definitely do something to keep it up, and that's with anything.
Right. So
hair.
With the facelift, there's upper and lower. You can be separated into two.
So L-therapy, it's by ultrasound. So it's the only FDA device on the market that you can visualize the target tissue and deliver the heat right to where you're going to stimulate collagen. So it builds and banks your collagen, and it lifts and tightens your skin. You can do different areas on the face, little parts at a time, like your upper lip, eyebrow lift, the full face, full neck. It definitely, it's a gradual lift.
But you'd have to start that early enough, because if your neck is sagging and let's say you're a bit older.
This is the other thing that prevention is key.
Right.
A lot of mid-20 to 30-year-olds are doing this to prevent the sag.
I need to do this.
And it's
I
banking
need
their
to
collagen.
do this. Also because I feel like we had talked about it off the mic, and you had told me about the upper, which includes like an eye lift. And it was fairly cheap.
Well, that's the wow brow, they call it.
The wow
so
brow.
It will lift your brow. It helps with any heavy skin on the eyelids. And one treatment lasts a year to a year and a half. And you would definitely want to repeat that at the year point.
So the brow responds better than any other part of the face?
No, that's just if someone they didn't have the money to do a full face and they wanted to do little pieces. The brow lift is very popular.
So do you think that this is what a lot of the I don't want to say younger, but a lot of the 30-somethings are doing right now? We're tightening their jaw and neck and...
It is. It's preventative. I will tell you that Christy Brinkley has been doing L-therapy for years. She does a treatment once a year. And that's exactly what she does, face and neck. And L-therapy actually reached out to her and asked her to promote it because she was doing the treatment anyways.
So no cutting for her?
No. Non-surgical facelift with this L-therapy.
Well, she looks amazing.
She does.
She does.
She really does.
I think she turned 58.
And I like
I
how
think she's older.
And I like
I'd have
how
to
she
look into
looks.
it.
Yeah, we'll have to see.
She doesn't look young. She looks her age well.
She looks
done well.
Yeah, exactly. Well, I don't think you're ever going to really shave off years, but what you will do is look good for your age. And
I think that's the key.
that's the only thing we can do.
Right. Well, we can't stop the clock, but we can definitely do things to pump the brakes.
So I'm just going to ask about any side effects for anything. Is there any dangerous side effects with any of these procedures or anything?
Well, if you're going to somebody that's not licensed, there
Of
is,
course.
with injectables.
Why would you ever do that?
Yeah, people do.
Yeah.
Or another country or something like that, you have to.
Yep. You can cause blindness. There are serious side effects if someone's injecting and not knowing what they're doing. You can occlude an artery, a vessel.
Well,
Well, that makes it a little more frightening. But that's the key is, like you said before, it's who's working on you. You have to do your research, see
the
their
injector,
work.
yeah.
Yeah, and make sure you go to the right place. So, well, I am very interested, and I think Aurora and I
I'm very
be
interested
knocking
as
at
well.
your door constantly. Hello.
Well, just because I like, what I was saying before is injections don't have to be the first thing you run to. You can do laser treatments or any type of, mini face, these things before you run into the.
You can bank your collagen.
Exactly.
I didn't know collagen could actually be banked. That's really interesting.
Is it
Yeah.
true about collagen pills?
I don't know how much that really works, honestly.
Can you
Because you see
ingest
this,
it?
what is it, Vital Proteins? They have this.
Oh, the drink?
Well, yeah, and they have the collagen drinks. That's the rage. And I wonder if it's true.
Well, it's like a lot of people have a cabinet full of vitamins that they take every day, and they say, do these really work? How do you know?
It's a placebo, perhaps, if they do.
Well, with hair, I always tell clients, take biotin.
You have to take a lot of it, but biotin can work. I think the best thing you can tell someone for their hair that's not to help them grow it is massaging.
You think so?
Without doing this PRF or transplants or wearing a hairpiece or whatever. But yeah, because a lot of times I think what happens is people stop touching, washing, brushing their hair when they're losing it.
Because they get scared.
They're afraid.
They're afraid of it. So what they do is they consciously neglect it.
Yeah.
And I think if they start back in with the massage process, it's going to help.
But I don't want to knock vitamins completely because I do think that I've always taken prenatals, and I know that people are always like, oh, only take them when you're pregnant, and I don't believe there's truth to that. I've taken them
Really?
all year, and they've always been like a nice cushion for hair growth for me.
You only know what works for you,
It
and
doesn't
we're
have
all
to work for
different.
everyone, but
right,
I
we're all
do.
different. There's certain vitamins, magnesium, glycinate, I love. It helps me relax, gets rid of some of my cortisol.
Really?
Yeah, magnesium glycinate with zinc. I take those two together at nighttime. And I notice a difference when I don't take it. I'm a little more anxious. But I tend to be a little bit more of a anxious person anyway. But
Maybe I should start taking
try
them
it.
too.
Yeah,
I know.
absolutely.
And B12 is excellent too.
You do
for hair
injections,
loss.
don't you?
Yes.
Of the B12?
Yeah.
Now, where do those have to go? Are those in the butt, or could they actually go?
Well, it's into the muscle, so it would be the deltoid, or some prefer, in the butt. But generally, I just do it in the upper arm.
And how often would you suggest getting those?
Well, most like it once a week. It's water-soluble vitamin. Your body's only going to use what it needs, and then you'll pee out what it doesn't need.
And what does that actually do for
Yeah, I
you?
was
What
going
do
to
you
say,
think?
what does
Yeah.
it do?
There's so many benefits. I mean, it can help with mild depression and anxiety. It helps lift the mood, helps increase metabolism, burn fat. It helps with mental clarity,
I'll take that.
your immune system, sleep patterns.
We'll
It
add that to
improves
the
that.
list.
Well, seriously, why wouldn't you want to do it? But why can't, so I wouldn't be able to take B12 vitamins and get the same.
Well, some people take it sublingual under the tongue, but the absorption is different through the
It's
gut than
different.
it is through the muscle.
Okay. So if I just took B12 vitamins and kept building it in my system, it's not going to do
It's
the
not
same
going to
as.
build up. It doesn't interact with any medication. It won't become toxic. You're going to excrete in your urine what your body doesn't need.
And the best way is from injections of it.
Well, the best absorption is through intramuscular injections over, oral through the gut.
Well, we've learned a lot today.
Yes, we have. So it's been so fun and informative podcast. Thank you for coming on here.
Thank you
and
for having me.
sharing your knowledge. Where can our listeners find you?
I'm located in Reading, Mass. on Main Street. And my website is poncedelionmedspa.com, and all my social media links you can find on my website.
Ponce de Leon, Fountain of Youth.
Yes.
I like that.
I love that. We've been to the Ponce de Leon
We've
Fountain of
been
Youth.
St. Augustine. Yeah.
St. Augustine. We drank the water.
We drank the water, which tasted like
Metal.
metal. It was disgusting. My mother kept telling us to drink the water. Not a good idea.
It's like this little cave, and it's very
Don't
strange.
drink the water.
Don't drink. God only knows what we drink. But if you want to contact us for information from Deb, or if you just want to ask us any questions or any topics that you want to discuss, or
We'd love
have
to
us-
hear
yeah,
from
we'd
you.
love to hear from you. So contact us at noelle@noellesalon.com, and you can listen to our podcast on iTunes and Spotify. Please subscribe and share.
Yes,
Please. So what do we have next week? We have a fun episode next week,
It's
right?
a family affair. We are doing you can say.
Keeping up with celebrities.
That's it.
Keeping up with celebrities. Well, who doesn't want to keep up with celebrities?
And we should have had Deb with that, because we're going to talk about their fashion and style, but also what they're doing.
We're going to dish and dis.
Well, yeah, we're going to talk about what they're doing, like with their surgeries. And you know what we noticed, though, along the way? They're all looking the same.
They are.
All of them.
They are. And I think it's going to go back to the ones that are going to stick out are the people who actually probably don't do as much,
Have wrinkles.
right?
Right.
Well,
Maybe.
we shall see.
We shall see.
Thank you.
Thank you for tuning in.
Thank you.